Hi there. Welcome for our live Q&A on patient experience, on branding, and on marketing. I'm excited to have you here. If you have questions you want us to address today, please drop them in the chat on the side and I'll address them. Otherwise, I have some other questions that we got from individuals before the event, and we will start with those. We'll get started in just a few minutes. If you are here, if you wouldn't mind just giving a thumbs up or a comment to make sure you can hear, that'd be great. Perfect. Thank you very much. Appreciate it. So I'm going to wait one more minute and then we'll get started. While we wait, I will introduce myself. I'm Sally Meldrin. I'm the CEO of Clarity PX. We are a boutique agency that helps healthcare organizations really align their brand, their culture, and their patient experience. And it's our firm belief that it's at that magic intersection where real growth and transformation takes place. So we're excited to be talking today about experience, brand, and marketing, and we welcome your questions. Place them in the chat if you've got them. So we will go ahead and get started. I got several questions ahead of time from folks, so we will be addressing those. But I wanted to start first with, what is patient experience? You know, in my corporate experience with healthcare entities, hospitals, insurers, with systems, with clinics, and even honestly, as a caregiver originally, I was a rehab therapist. The idea of patient experience has been thrown around for years. And it's something that still is kind of in the evolving state in healthcare for more than 10 years now. And so to me, patient experience is really that collective whole of interaction and experience, both felt and seen and personally experienced with your entity. Now, you might think, holy cow, I don't have that much control over it. And that's exactly why we want to talk about what we are today, is so that you can understand, what is it that you can do as a marketing or an experience leader to help influence a better patient experience across your system and a better experience for your colleagues, your caregivers, and your providers. So for us, patient experience really is kind of, it ends up landing in one of four buckets, if you will. And these are the buckets that we would help healthcare entities with. One of them is around employee engagement. And that is a very big concern and a very big need now in healthcare post pandemic, with the massive shift of nurses away from the field, with the financial stresses of the coming out of the pandemic and into the recession. Staffing remains a very high critical priority for organizations, especially in healthcare. You add on the safety concerns of some of the healthcare providers, and there is a whole world of concern and energy being put into engagement of employees. One of the things that I think is really important, and what we have seen lived out in our work experience, is that the engagement is not just things and stuff and programs and snacks, but honestly, in reading a book called Compassionomics, which was written by physicians for physicians, really examining the idea of healthcare burnout, the thing that really was found in these scientific studies, where they had bodies of patients in two groups. One was care as normal, and a lot of these patients were in palliative care or end of life planning, or just gotten stage 4 cancer diagnoses, so very severe kinds of traumatic healthcare moments. And they had groups of patients, hundreds of them, where it was just standard care as normal. The other group, the test group, same place, same providers. The only difference they did was to add a a sentiment at the beginning of, I know this is so much and overwhelming, and it is a lot to take on, but I want you to know that we are here with you to walk with you through it. And that 6-second sentiment of empathy for the patient resulted in some cases 40% less pain, in longer lifespan, in healthier living, in more positive mindset for those patients. And that's just one of the hundreds of studies that have been done in this book, where it's showing that the application of empathy for patients, but also for the providers, was the solution to healthcare burnout. Because what they discovered was, when providers are just going through the motions and feel like a cog in the wheel, when they just have to go through this checklist in the EMR and get through this and say these things and give this paper and hurry in and out, and they don't have time to really stop and truly connect with compassion or with empathy to the patient, that was the number one influencing factor on burnout of providers. And I think it's fascinating, because if you take that idea and expand it to the context of employees, whether it's a medical tech or a receptionist at a clinic, whether it is a provider, whether it is somebody working in the support services for the facility, when there is an absence of compassion, of empathy for the humans that make up your organization, that's where you begin to find the syndrome of quiet quitting, of disengagement, of just going through the motions, and of lower employee morale. So for us, we know that employee engagement is one really important bucket to patient experience. You might be going, what? That's not the patient. It is the patient, because your staff and the humans under your watch are the ones who are caring for the patient. The second bucket is really around communications and technology. And often customer experience and patient experience get dissolved down to tech stack or a new website or a fancy app or whatever. And I saw a study a week ago in healthcare, and also globally, by consumers. They would rather have a good experience than seamless tech. Not that tech is not important, it totally is important. And it's important in order to individualize and personalize the care experience. But if your emphasis is entirely on communication tech and not on empathy, on in person, on solving little friction points, then you still may not see your patient experience scores impacted like you'd hope. The third bucket is really around your brand and your message. So it's one thing if a marketing team is out putting up billboards and ads and flyers and notices to all the patients and the website and social and out at events. It's one thing for them to make a brand promise. It's another thing for your team to be having your care experience wrapped around that purpose and that promise. And this is an area where I see healthcare kind of get it wrong a lot, where some of our clients will come to us and they can list in a hurry all the programs and locations, the services, the care lines, the blah, blah, blah. But what people want is to know how your service, your organization align with what matters to them. And that often isn't just a list of care services. It's, who are you as a brand? What is your mission? What do you stand for? And that kind of powerful connection then will flow into that fourth bucket, which is cultural enhancement. So when we've done work previously with Fortune 50 Medicaid insurer, one of the things that we identified was member and patient experience was terrible, less than 50%. Provider satisfaction and experience, terrible, like low 40%. And the employee engagement also was bad. And when we unpacked all of those elements around the human experience, we identified that the things that they needed all could be related to this body of, this is who we are. We know what you want. We want to meet you where you're at as a patient. Provider, we know that is what's most important to you. And employee, you're frustrated because you have not been empowered to meet the patient where they're at. So when we were able to solve for that collective human experience that all wanted the same thing, we saw double digit, like almost 40%, between 30 and 40% increase in patient satisfaction, in provider satisfaction, and also in employee satisfaction. That took an intentional weaving of the brand, the mission into the culture, so that what we were rewarding was aligned to who we are and what we say we did. What we were measuring and supporting in accomplishments included those cultural promises. What we said to the patients and the members externally in our brand promise aligned with who we were and what we rallied around as an organization from our culture, from the top down. And so patient experience is not just simply a new fancy app or a website or whatever. Patient experience is really about making sure that all the humans in your organization are aligned, that they are empowered, that your greatest competitive differentiation is that your brand purpose and your team are aligned and they feel empowered to deliver that to your end user, the patient. So I'm going to jump into questions now. If you have questions, please drop them in the chat. We'll be happy to address them. So we get asked all the time. I got asked again in a professional organization that I'm part of. And one of the questions that I get asked is, how do I get buy-in, or how do I even get started on patient experience? It's been talked about, it's been kicked around, it's been prioritized, then deprioritized, it's been shuffled around in the organization. It's been owned by one or by some, it's been changed. And I know that patient experience in the healthcare setting is vital. So vital that Centers for Medicaid and Medicare Services have also prioritized as much as 40% of a healthcare star rating is based on patient experience measures. That's huge. It used to be completely HEDIS related, and now they are overemphasizing the CAHPS survey and the questions to the patients and to the end user on how is their experience, how is communication, how were they treated with respect. There are so many more elements to the star rating for organizations in healthcare, almost 40% than there was even 3 years ago. And you all know every additional star rating is big money for healthcare. For instance, for a Medicare Advantage plan, if they have a 4-star rating versus a 5-star rating, 4-star, they can enroll just during the open enrollment period in the fall. And if they have a 5-star, they can enroll year round and they get reimbursed more money. So for every additional enrollee, they make several $100s a month. So when you compound that, it's worth millions of dollars to that organization to sustain and maintain a 5-star rating. So it's the same is true for all healthcare organizations. And I will just add in here a random stat from another research study that showed that more than 80% of patients said they would not select or schedule with a provider who had lower than a 4-star rating. Now, I know that's not the same thing as the CMS star rating, but the ratings and the rankings for consumers and patients are essential. It is a trust factor, and people look at them, and consumers and patients take note of where your star ratings are. So it's important that your experience aligns with your words and your brand promise, and that your people are empowered to deliver that experience. So, to get started, and how do you really get buy in or gain traction with patient experience? I think the biggest thing we see that is missing, and some recent studies showed that more than 60% of leaders cannot tie their impact. They can't demonstrate a ROI. They can't tie the initiatives that they're doing to the KPIs of the organization. That's the problem. When we don't have the foresight or the wherewithal to connect what we're doing to the most important business needs, you're going to make yourself vulnerable, your program and your initiatives. So, the first thing that you have got to do is to really identify. Go to the CFO, go to the revenue manager, go to the CEO, the COO, whatever. Go to the leaders in your organization and make sure that you know what are the key business goals for your entity this year. And I don't mean be the leading provider in the region. No, I mean we want to grow primary care by 32%. We need to have this many more knee and joint replacements. We need to get specific and know exactly what are the revenue targets for your organization, in which care line, and then the next thing you do is identify where are there primary friction points in your experience. How do you know? You look at the content that is coming up, whether it's social media posts, reviews, what is online, what are people saying in the clinic, what are your frontline staff bubbling up, what are you getting told when you're out in the community, what are the Press Ganey scores saying, or the other surveys. Now, the problem with the Press Ganey and some of those other CAP surveys, those kinds of larger surveys, is typically they're a lagging indicator because they take months to process. So, and I've had CEOs in healthcare tell me, I'm not going to listen to social media because it's not a formal survey instrument. But I will tell you what, the feedback that you get from a patient or a consumer when they are just using their own words is some of the most powerful feedback available to you. In fact, the Barrel Institute, which is huge on patient experience, did a whole study and identified they got the most specific, the most vulnerable, and the most helpful feedback by and large in the free form comments at the end of a survey. You could have all these standardized questions, and everybody interprets it different, but when they are using their own words to express how their experience went, pay attention. If you have a call center or you record phone calls, that is a gold mine of consumer information that you can capture. Use some natural language processing technology to capture the themes and figure out, what are your consumers saying about you? Whether it's on Reddit, Facebook, on your Google page, wherever the feedback is coming, pay attention. And when you can identify themes of what is happening, when you can identify themes of what's bubbling up, pay attention to those friction points. And then when you can take that, your business goals, What are the friction points or gaps or opportunities in your experience? How do you connect the two? That is the best way for you to end up getting buy-in and support. And the best way for you to demonstrate ROI that, okay, we need to drive more volume in primary care, which means then we're going to align our patient experience tactics. Maybe your provider directory isn't up to date, or maybe people don't know who are the primary care physicians. Maybe you need to do a campaign that talks about it. Maybe you have new primary care physicians that you need to fill their schedule. Whatever it is, then you can tie the things that you're working on to that key goal to drive more revenue in primary care. And healthcare, we all know, primary care then trickles down into, oh, they need an ankle surgery. Oh, they need OB. Oh, they're going to have a baby. It trickles down into every other area. So primary care is just one example. So that's how you get buy-in, is that you align your work to the key things in the organization, connect the dots. And the thing that I will also encourage you, talk about it. We have clients who are at critical access hospitals. They've been in their role for 16 years. They have never shared the results of their work with their leaders. It didn't occur to them. You have to talk about your successes, your wins, the customer. You might get sick of it, but you are the voice that's going to keep it all before them. Talk about it often. Oh, hey, we had this campaign or this initiative, and we saw a spike in PCP appointments immediately following. Talk about the impact of your work with everybody else. So we have some questions. What are some ways to measure patient experience or symptoms I might notice if it's not going well? So again, the patient experience as a whole thing is difficult to just say, oh, PX is good or bad. That's where you need to really prioritize your thoughts and your direction and your tactics and initiatives around driving a specific goal. Often, when people start into a PX or a customer experience program, they don't stop first to identify, where are we heading? What does a win look like? We ask every new client that who talks to us, what does a win look like? And we unpack that with them, because if they just want help to grow their brand, and we don't know that that means I need to make $100,000 more money this year, we may do some tactics and grow their brand, get some more followers, but if we aren't converting to sales, then we've missed the mark. So take time to identify, what is a win? What does your destination experience look like? I'll give you an example. One of the healthcare provider that I worked for, the health insurance, in that, the provider, the member, and the employee engagement example, it was complicated and people were frustrated, so frustrated. Our staff didn't get it, our patients didn't get it, our providers didn't get it. So we set out as our goal experience, more help, less hassle. And that became kind of our rally cry, where we identified, where are the hassle points? How can we be more helpful? What is it that the provider needs? What is it that the consumer or the employee needs? How can we be more helpful? Empower our staff to be more helpful to the client. And so that was one of the things that helped steer all of our work, because you can't boil the ocean. And then we identified, okay, so if we're getting these specific friction points that are coming up, again, we're paying attention to the voice of the customer. Are they complaining about, oh, so complicated, I'm so frustrated? Or, in one instance, in that case, we wanted to be more helpful. And we identified a zip code in the Seattle area that had 92 spoken languages in one zip code in Seattle. And we had material in English. So we needed to be more helpful to the needs of those communities. And we expanded our materials. We did some research. We identified that, oh, this Russian population really, really resonated with icons and pictures more than words. We had it translated into Russian, into simplified Chinese, into Vietnamese, into all these other languages. And you know what happened? At the end of that next enrollment period, we captured 80% of the clients within that spoken language group out of that zip code, simply because we decided to target our message to help them. And so I think the symptoms that you would be noticing would be knowing where you're heading, what are the loyalty behaviors we're after, and what is the thing that's going to tell us that's not working. So if we are looking for more enrollments and fewer complaints, then we're going to pay attention to the complaints. If we're not getting the enrollments, then we need to figure out what is the piece that's not working. If we're looking at the web analytics, we can see that they were on the page and bounced right off, or they were there and dropped off. Okay, something's not working there. So it depends on what your goal is, but knowing where you're heading, what you're looking for, and then identifying what the complaints or misses would look like will be helpful. Another question, what are the top things I should have on my PX to-do list to get on track? I think, first of all, the top thing is to know your organization's goals, and they're changing. They are in flux. Staffing's a huge issue. There may be closure of services going to go on. There may be, expansion of services, or a new location, or revenue issues, or new doctors, or whatever, new relationship with a medical school so you could get people right in the door, partnerships with nursing schools. I've seen that in the news a lot. So knowing what are the primary goals and agenda of your senior leaders is your number one. If you don't know that, you're going to just march off into action and hope you're doing something that relates. And honestly, that puts you at risk. So the second thing that you need to do is make sure that you are testing your assumptions, that you aren't just deciding, oh, the consumer needs this, but that you are including the voice of the consumer in your decision making. We say it a bunch in our material. You are not your target market. It's so common in healthcare. The CEO or the doctor CEO or the administrative leader are like, we need billboards, or we need whatever. They just decide what the patient wants, and they march off into fixes that may not meet a need at all. And like I said from that research before, sometimes more patients would rather have a better patient experience than a really whiz-bang tech stack. So many organizations are trying to build their own app or trying to do whatever. And that's good if that's what the customer has asked for. But don't take a walk without knowing what the customer wants and how it relates to the organization. And then the other thing would be to really create important alliances within your organization. Know the revenue manager, know the operational leads in the areas that are dealing with the things you're trying to move the needle on. If you're trying to help improve the waiting period for the outpatient clinic, then be really close with the outpatient clinic manager. Be really close with the people who are measuring that process, with the staff in there. Make sure you have created the relationships that you can say, hey, we're here to help support this. What are you hearing? Can we try some things? When you work collaboratively across, up, down, and across the organizations, that is going to be the most essential foundation to helping you successfully lead change in your organization and to successfully tie the things that you're working to the patient experience. So, thanks for those questions. The other questions, I'll go to some others. One of the things that I got asked online was, how do I differentiate my business from other competitors with similar missions? And let's be honest, healthcare is really hard to differentiate on. You're not going to really be able to differentiate on price. Most places in the same region are going to have many of the same service lines. And so the greatest competitive advantage that you have this year is going to be aligning that brand purpose and seeing it expressed in your patient experience. We have a client that is a critical access hospital just on the outskirts, about an hour to 2 hour drive from a major metropolitan area that has a million healthcare facilities and hospitals and all the big systems. And they're like, well, we can't compete. But I'll tell you, if you're in healthcare patient experience and you don't know about this report, go find it. Monogle Human Brand Experience. The Monogle HBE 5.0 is their latest study. They do this report every year, and it's measuring the patient experience and the brand and what brands are getting right and what they still need to grow on. In their latest HBE study, it said, and it showed over the last 2 years, that patients are less and less committed to the big system, to the closest to them. And that, I've worked in some big systems, Kaiser Permanente and others, that is completely something that health systems rely on. Oh, we're the biggest. Even for specialty care, cancer, for specialty orthopedic, for those kinds of services that aren't just typical, the same is true. Over the last 2 years, there has been a decline in the preference of a consumer to visit those huge systems or the one closest to finding care that is going to meet their needs and understand their personal preferences. Now, some of that was related around wanting more holistic and naturopathic and chiropractic and some other nutritional support, not just go see a doctor, write me a prescript. So it's some of that was around that, but a great majority of what that study was around was people of various ethnicities, of different races, of different orientations that were feeling out on the edge with their healthcare providers. And we have seen a lot of, geopolitical and racial kinds of things in our news this year and the last couple years that really indicate that, the Asian American or Asian Pacific or the Hispanic audiences, a lot of those patient groups are not feeling the love inside of healthcare. In fact, in some cases, like with the Hispanic patients and customers, they're in some cases afraid to go get care. And so when we can take our brand purpose, which is to help make, this area healthy, or to help them walk in holistic health, or to address the social determinants of health, whatever it is your mission, those kinds of terms typically fall within them. How are you applying that to people in your area? LGBTQ, the racial diversity, the age diversity, the Gen Z versus the boomers. How are we creating a space within our brand that meets them where they are? For this little critical access hospital, we're talking about, sure, you're 2 hours outside of a major metropolitan area, but you could walk through those halls every day for a year and they would not know you. So, what is it about this personalized kind of care you're going to be able to get in a critical access setting that would meet the need of a mom with kids? In this years of pandemic, I don't want to haul my baby to a huge facility that has 10,000 employees and 13,000 patients in it. Nope, I'd rather go to something small that's close to home, that's safer, that it gets me, that understands where we live, that knows the triggers that are important for this community. So when you can find those kinds of advantages to who you are and how that would resonate with the customer you're trying to reach, that will be a powerful way to differentiate your business. And in 2023, differentiation is going to be king. So we also got asked, let's see, another question. One of the questions that we got asked also was around we it's hard to get support for patient experience because we don't have a huge budget and we don't really know how to start. And my suggestion to you is start small. We think, oh, we need $600,000 or $1 million for a new EMR. No, that's not the way it needs to roll. In fact, you'd be better off to start small, to find a broken experience and fix that. One urgent care system that we were working with, they had 37 clinics around this metro area. And the same issue was coming up in the waiting area of the urgent care center. So we addressed that. People also were frustrated having to go to urgent care and wait hours and hours and hours. So instead, we implemented a online system where they could put their name on a list and schedule an appointment at urgent care. It was amazing. It changed the net promoter score from 70s to the 90s, and it was pretty easy to implement. Now they knew they could get on the list and then drive from work and get there and be there ready at a time when they were scheduled. They would be in and out within 30, 45 minutes rather than 4, 5, 6 hours. And it increased satisfaction huge. It was one broken experience. Now, sure, that case involved the implementation of a technology which actually was not very expensive given the whole system. But there may be something as simple as one standalone ambulatory hospital that we worked with. There were complaints that the staff were not very nice, and it was hard to understand because they were pediatric and the caregivers were amazing. But when we dug in and discovered the receptionist in the lobby, she was the receptionist. She was answering the phone lines, greeting every guest, signing them in. She was also asked to help do accounting paperwork in the system at the same time. So this poor thing stretched in so many positions with doors coming from both sides, phone ringing constantly, and her support were 80-year-old volunteers who couldn't hear, had to yell because they couldn't hear. And so the the sense and the first impression from that organization was they're cranky. The the older volunteer, bless their heart, they were very valuable, but they should not have been at the front desk. And the receptionist was pulled in way too many ways. So we were able to fix that experience without spending any money. We had security people on staff who were in the back watching a camera. We moved their camera stuff up to the other desk. They checked in and greeted guests, made sure that they were logged in, part of the security function anyway. And then we were able to greet with a happy face. The receptionist was moved to where she could focus on just the phone and the accounting work. She didn't have to do the public greeting thing. Trying to be an accountant and a bubbly receptionist at the same time is a challenge for anybody. So, just a simple little fix. And you know what? That complaint stopped happening. And our net promoter scores went up, our Press Ganey scores went up, our client satisfaction went up. And oh, by the way, that employee was way happier and able to do her work, do it better with more focus and fewer mistakes. And everybody was part of the solution. So it cost us $0. It just took some creative ingenuity to rearrange. So make sure that you don't have to like make it huge. Find the broken experience. I think it's important also when you're working on patient experience to not underestimate the power of people managers. It shouldn't just be a siloed thing that I'm fixing for my area, but every people manager in the organization needs to know these are the things we're working on. Here's how you and your staff make a difference. Here's tools to talk, whether it's talking points or, okay, we're going to route these complaints here. We're especially paying attention to this. This is what you can say. Those kinds of tools are vital that the people managers can use at every time they meet, that they can use in their newsletters or their emails or their one-on-ones or whatever. Make sure that you're collaborating across the organization and including the people managers. And then the last piece would be connect those two. When you found, or excuse me, maturing your PX team. If you have people helping you lead this in the organization, there's so much research that shows that they just aren't being developed. So those staff, your PX team, whether it's they have that title or not, or they're on your committee or whatever, they need to understand with clarity, what are you doing? What are you focusing on? How do you know if it's working? What's our goal? They need to be indoctrinated, if you will, into the position and the focus and the emphasis that you're doing. And they need to be able to know how to speak to it in their circles. And often, again, back to the example I had of one of our clients who's like, oh, it never occurred to me to share the impact of what we're doing. Well, I can tell you in this day and age when budgets are tight, when staffing is tight, if you're just happily going along and doing stuff and you can't demonstrate its value, you're going to be at risk and your budget is at risk. Your positions may be at risk. And that might sound harsh, but the truth is that you have to be able to, find those experiences, include and collaborate across the organization, get the people managers involved, and then make sure the people of your team are maturing, that they know what you're doing, what's working, how they can be including others in the organization and telling the story of the patient and the patient experience impact every time they're in a meeting or wherever they can in the organization. Those kinds of insider voices help improve your patient experience quality immediately, and they help spread the impact and your buy-in for it as well. So I had one last question and then we will be done. Let's see. One question was, how do I care for my patients and still make a profit? So I would hope that through this conversation that we would understand that patient experience is no longer a nice to have. In fact, I saw a study this week that said like 50 something percent of all customer issues, 56%, I think it was, go unresolved. And a recent study also showed that as many as 80% of people will change brands, will leave and go somewhere else after one bad experience. That is a very costly lesson to learn. The patient experience is no longer kind of a, oh, that's for the Cleveland Clinic or the Mayo Clinic, whatever. It is for every single interaction. And the people who are your content, the way you treat them, all of that is going to build relationship. That from relationship, you can build trust when you're consistent, when you have been respectful, when you've heard, when you've responded, even when you didn't get it right, as long as you're honest and saying, you know what, that wasn't the right way to handle that. And we appreciate your feedback. How can we do better? That kind of conversation builds trust. And then from trust, you're able to build loyalty, and loyalty is money. When you have a customer who will say, "Oh my gosh, I love Dr. So and so and this clinic," that referred word of mouth is powerful. And healthcare consumers consider an online review almost equally as they do a word of mouth referral. So when you have people who are out there saying, "Oh, I love this clinic. They're always so great." That is powerful because those referred customers are 7 times more likely to refer others. They often are a higher revenue generator. They will come back for other services, they will refer to other people, and so customer experience, I would start with what you can. If you have a complaint about how uncomfortable the chair in the lobby is, fix the chair. Um, Start with what you can, and then fix the next little thing, and then the next little thing. And all of those subsequent expressions of, we hear you, we see you, we acknowledge you, we want to make this better for you, will add up and begin to really influence your reputation, your loyalty, your trust with your customer. And that is the most profitable business of all in every sector across the globe, healthcare or not. That is the most important thing that you need to be able to do. So I hope that this was helpful. If you have questions, if you're watching this afterwards and have questions, email us at, we'll put the email address in the show description. I also want to tell you that we have a strategic checklist that is free. It's a 15-page document. We basically have taken our life's work and put it into a template to help you really think through all the things of you're planning a PX initiative or a marketing initiative or something with your brand or even an employee engagement initiative. Think through all the pieces so that you're sure that you know where you're heading, that you know how to measure if you've got there, and that you know what to look at to make sure you aren't just taking a walk with no one following. If you want that, we'll put the link also in the show description. And follow us online at Clarity-PX. We're on Instagram, we're on LinkedIn. We'd love to have you follow us for more patient experience tips. And if there's anything we can ever do to serve you, please let us know. We appreciate you joining. Thanks for being here, and share the news. If you loved this, tell other people about it. We'd love that. Thank you.